business for a large technology firm, and then there are others with equal experience in services and so on. So the board is very experienced both in healthcare and services, and so the board is actively involved in helping us with our strategy. In terms of financials, like I said, we've been growing between 11 and 14% over the last 4-5 years. FY24, you see the numbers, our top line was close to 4,800 crores, and our adjusted EBITDA margin was 11,171 crores, and 589 crores was the adjusted PAT. There are a few adjustments. I can never leave the US, right? Even though we do the work, we never export the data from the US. Data is never stored in any other country outside of the US. So even when we build applications and we do work for our clients, we host all of that in the US. People log into those applications, people work off the data in the US, but they can never download and store it on the local. And then there are a number of other security protocols that we follow to make sure that the data is secure. But that's a very important point for us, because if you can't ensure that, you will not be able to get the business or run the business. Right? Your second question was medical coders. Medical coders, think of it this way, right? In the US, when a bill is generated and sent to the insurance company, you will not see too much English in the bill. It will all be numbers, right? So whatever procedures that the doctor or the hospital did, all of them have to be converted to codes. That is the job of a medical coder, right? So if you, for example, if some surgery was done, it could be coded as 283.2, right? If there was some complication, it will be a different code, right? There will be multiple codes. So it's understanding from the operating notes whatever services were provided and converting them to billable codes is the job of a medical coder. Right? And what was the third question?
Public issue, arithmetic.
Option दोनों था. Senior management तो India में है. The company started in India. First location, delivery location was in India, and all of the senior leadership sits in India, right? I operate out of Bangalore, right? So India is and our highest headcount is in India also. Basically, if you look at all of the large outsourcing companies in India who are public, their business model is also similar, right? Most of the clients are outside India, but the large delivery happens out of India, and we are very similar to that. So option is we could have listed in the US or we could have listed in India, but India is where most of the leadership is.
Will the elections in US affect your business?
We've operated this business since 2000. I personally have been running this business since 2011. So in Individual Global Solutions, I was running the healthcare business since 2011. Right? Since 2000, we've had how many? At least 5 or 6 changes of government, right? And both parties have been in power, right? It's not really changed the trajectory of the business, right? The business has only grown, right? Healthcare is a very sensitive topic, so it is discussed in elections. But if you look at it this election, healthcare mentions are far lower than what it was in the past, right? But even when it was a very hot topic in 2012, 2016 and so on, it didn't directly impact the work that we do, because the work that we do is helping our clients improve their operations efficiency and run the business, right? So we don't directly do work that impacts policies or impacts the health of the end consumer. We're just improving them in their operational efficiency. So it's not had any impact on our business, and we don't think it will have any impact.
I would like to thank Ramesh for giving
controlling the volume of services. It can happen before the service is provided, it can happen when a patient is in the hospital, because typically when a patient is in the hospital, the insurance company will approve, let's say, a 2-day stay, right? But if the doctor wants to keep the patient for a third day or a fourth day, they need to get additional approvals from the insurance company, and that's where again they need to submit medical documentation, which our clinicians will review and decide whether to approve or not. The other way to also control cost is how do you proactively identify who are the members who are at higher risk of getting ill, right? And how do you engage with those patients, make sure that they are taking their medication, making sure that they visit their doctors and so on, so that they don't end up becoming a high-cost patient in the future. So that's something called population health management, chronic condition management. So these are all clinical programs for which we need nurses and other clinicians to do the work. So we hire nurses in let's say, Philippines or in India. We train them on US healthcare. They get certified as what we call USRS, US registered nurse, and then we deploy them on these projects for our clients. And then the others is all of the other activities that a provider needs to do. Like I said, our health insurance companies manage large provider networks, right? So these are groups of hospitals and physicians that they contract with. And before they contract with them, they need to what we call credential the providers. They need to make sure that they're empaneled to be on the network. So they need to do a lot of paperwork, and all of that is what we support them on, right? Getting the providers on board, managing their contracts, managing enrollment of members, managing premium billing and collection, because commercial contracts with employer groups, they need to bill them for the premiums, they need to collect premiums. So all of the work that a payer needs to run their operations, we support them on all of those matters. And then the last column is what we do for providers, which I described already. So we help them with financial clearance, we help them with billing, we help them with and healthcare being a very regulated industry, we need to have a lot of certifications before our clients will give us work. And so that's something that we have. So we have all of the required certifications to be able to perform this work. So this is the split of employees. 45% of our employees are based in India. 39% of our employees are in the Philippines, and the balance 18% in US, Jamaica, and Colombia. And what you see on the bottom left is we have close to 2,000 clinicians, right? So these could be nurses, these could be medical coders, these could be pharmacists, dentists. So we employ a number of clinicians. Like I said, they are involved in some of the clinical work that they do, but we also use them for other programs to support the rest of the people. So about 60% of our workforce is women, about 40% is men. And our attrition is different by different geographies, but overall, all geographies put together, our weighted average attrition is in the low to mid-20s. So let me talk about the market structure, right? So in the US, if you look at the payer or the health insurance market, it's a market where there are some very large payers, and then there's a mid-market and a small market. So the national payers are the large ones, the payers who operate in multiple states or all over the country. The top 17 companies, the large insurance companies, their combined revenue is $1.3 trillion, right? So huge companies. And the top 7 of those 17 companies, each of the revenue is 100 billion or greater, right? And 3 of them, like I said, are our clients. So these are 100 billion plus companies, very large companies. And so the number of members that they have is in millions of members. And so the work, the operational work that they need to do is very large. And that's why these clients of ours are large and they continue to grow year on year. The next set of clients are what we call Blues. Blues is a very specific term in the US. It's a Blue Cross or a Blue Shield plan. And each state will have typically a Blue, right? So they don't typically compete with each other. There are 33 Blues. When we call them mid-market, the 33 Blues combined have about 450 billion in revenue. And 12 of them are 10 billion or more companies, right? So these are still very large companies, even though we call them the mid-market, because the nationals are $100 billion companies, right? So these are still large companies, and that's a segment that we are actively pursuing. Locals are the smaller ones. There are some large local plans, but most of them are small. So think of a national having millions of members, whereas a local will probably have 100,000 or 200,000 membership, right? So there are a large number of locals. Historically, we didn't focus on the local market a lot because we got most of our revenues from the national providers. But in the last 2 to 3 years, we've been actively focusing on both the Blues and the local market. And providers, again, there are some very large hospital groups and health systems. but then that's a market with a lot of providers in the small and medium range as well. So this is details of our revenues. If you look at our new client addition in 23 and 24, we added 7 clients in 23, 13 clients in 24. And on the right, you see the breakup of our clients in terms of the dollar distribution. So we have 5 clients over 20 million, 7 clients between 5 and 20 million, and so on. So these clients over 20 million, like I said, some of them are the national players, very large companies. And if you look at the bottom, that's the growth of our top 3, top 5, top 10 clients. If the top 5 clients, like I said, between FY 23 and 24, they still grew over 10%. So these are clients who've been with us for, like I said, an average of 17 years, but they still continue to grow at a very high rate. And the reason they continue to grow with us is because of this, right? So typically when a large client contracts with us, like I said, we can support them in every operation that they do. But they typically may not buy all of that together, right? They may contract with us for 1 service or 2 services to start with. This is a client who's been with us for like 14 years now. In the first 2 years, we just did 3 different services for them. Between years 2 and 4, they gave us 4 additional services. Between years 4 and 8, they gave us 5 more. And between years 8 and 10, they gave us 6 more, right? So that's how we continuously get more opportunities, more services to perform for them. And so for this client, after 14 years, we are doing some 30 different things for them. And so that's how we continue to grow our existing relationships. In terms of technology, like I said, we do deploy a lot of technology in our operations. 10 years ago, you might have heard the robotic process automation, things that are very rule-based can be automated by bots. So we do deploy those bots in large numbers on the platforms that we operate in. And so if, just to give an example, if an activity takes, let's say, 5 steps, there may be 1 or 2 steps there which you don't need a human to perform. A bot can do the job. So we deploy those bots to help improve the productivity or the efficiency of the work that we do. Similarly, later we used NLP, NLUs, how do we extract data from text, complex recognition. And today we are doing a lot of work using AI and GenAI, right? For example, we acquired a company called Birch AI earlier this year. Birch was a company which was working using GenAI in the healthcare industry. And since we only do healthcare, we were interested in them and we acquired the company. So today we are doing a number of use cases using GenAI, right? So in this slide, if you see, there are lots of pilots that we are doing in the front office, in the back office, in the clinical work. And like the example that I gave, so if in a prior authorization, if a provider is sending, let's say, a 40-page medical documentation, for a nurse to review the 40-page and make a decision whether to approve or not might take 45 minutes, right? But today, using GenAI, can you reduce the time to 20-25 minutes is the objective, right? So GenAI can basically read the document, it can identify what are the key parameters there, it can compare it to the client's medical policy, and it can present that summary to the nurse who can then make the determination whether to approve or not, right? So for us, all of these are tools that improve the productivity or improve the efficiency of the work that we do.
I welcome you here and thank you all for your participation in this conference. Let me begin with a quick introduction of Sagility India Limited management on the dais with us. We have Mr. Ramesh Gopalan, who is the MD and CEO of Sagility India Limited, joining us today. Established in 2021, Sagility provides technology-driven services to both payers and providers, covering core benefits administration and clinical services. This includes claims management, payment integrity, clinical management, and more. For providers, it offers revenue cycle management services to help with billing and treatment cost claims for payers. It also extends some of its payer services to pharmacy benefit managers who manage prescription drugs for insured individuals under health plans. We are extremely glad to launch the Sagility IPO. Let me quickly summarize the IPO details for all. Total issue is 2,106 crores, including an employee reservation portion of 5.3 crores. Price band for the IPO is set at 28 to 30 rupees. We look forward to your support to make this IPO a huge success. I will now hand over to Ramesh to give you a quick brief on the business. Thank you.
Thanks, Amrita. And thank you all for coming. I know it's Diwali and all of you still meeting, so thank you very much for coming. My name is Ramesh Gopalan. I know the business, the way Amrita described, probably sounded too complex, so I'll try and see if I can simplify what is it that we do and who we are. Just to set the context, this business, Sagility India, is a company that was formed in January 2022. So as a company, it's just less than 3 years old. But the business has existed for 24 years. We were part of Hinduja Global Solutions. It was a Hinduja company. And this was the healthcare division of Hinduja Global Solutions until December 2021. Barings Private Equity Asia, which is now EQT, they acquired the healthcare business from Hinduja Global Solutions in January 2022 and made it a private company. So that's the company that got renamed as Sagility India. And so the company is about 3 years old, but the underlying business is about 24 years old. Let me use this one slide and try and give you an overview of who we are and what we do. What we do, we focus on healthcare. Healthcare is the only domain where we play. So we don't work in any other industry but healthcare. And even within healthcare, the work that we do is primarily for US clients. So all of our clients are in the US. And in terms of clients, we have two sets of clients. One client in the US, we call them payers, but they are nothing but health insurance companies. So think of health insurance companies and I'll talk about how we help them. So that is one set of clients. And about 90% of our revenues come from those clients. And the second set of clients is what we call providers. But providers essentially any entity which provides care to patients, right? So it could be a hospital, it could be a group of doctors, it could be a lab company, it could be a radiology company, it could be any other diagnostic company. So all of them in our terminology is providers. So the work that we do for providers gives us 10% of the revenue. So that's what the company does, 90% for payers and 10% for providers. And if you look at the payer or the health insurance market, there are some very large companies in the US. The 10 of the top insurance companies, we have 5 of them out of the top 10 as clients of ours. Right? So these are very large companies. I'll talk about that in a subsequent slide. And 3 out of these 5 have been relationships that we've had for several years. So if you look at our top 5 clients, these top 5 clients have been with us for an average of 17 years. So one of the clients is the one who started the business in 2000. So that client has been with us for 24 years. Another client has been with us for 21 years, and so on and so forth. So the top 5, if you average out the number of years they've been with us, that averages to 17 years. So what it says is we have very deep relationships over a number of years with our clients. And not only that, these top 5 clients still continue to grow for us. Last year, the top 5 clients grew at 10%. So these are large companies, long-standing relationships, and these companies still continue to give us more and more work so that we continue to grow. So that's very unique to our business. Now, specifically, what is it that we do for payers? Think of a health insurance company, all the stuff that it needs to do. It needs to, every year, enroll new members. It needs to onboard those members. Once the members are onboarded, they'll start to see doctors and go to hospitals. All of the claims will come to the insurance company. They need to handle those claims. They need to manage large provider networks. They need to get into contracts with providers and manage those networks. They need to credential the doctors and so on. So everything that they need to do to run the business, we support our clients in all of that. So think of us as the closest example in the Indian context is like a TPA, right? So everything that we need to do to run a health insurance company, we support our clients in all of that. We may not do everything for every client, but we have the capability of doing all of that, and across our clients, we do all of those functions. So the key aspect there is the spend that our clients make on us. It's not a discretionary spend. It's not a project that we are running for them. So if they are under cost pressure, they can say we'll put this project on hold till our financial situation improves. So that's not the kind of work that we do. What we do is core operations. So even in good times or bad times, they need to do all these things to run their business. So that's what we do for our clients. So for us, what it means is our revenue streams are very predictable. So every year, at the beginning of the year, we have good visibility into what the revenues for the year will be, because once I start, for example, doing claims for one of my companies, I will do claims for them for the foreseeable future, right? So I know what their membership is, I know how many claims are likely to come this year.